All right, so let's take a look at chapter 21 material right here. And again, with chapter 21 material, it's all about the blood vessels, arteries, veins, and how blood moves from one region to another. So when we're looking at this, it's important because we're going to start discussing blood pressure and what it means. And you will need to know what does systolic blood pressure represent, and I want you to do your own research to figure out what diastolic blood pressure represent. I'm going to give you a hint. All right, I kind of mentioned what systolic was with the previous, with chapter 20 lecture. All right, but I'm going to give you a hint about diastolic blood pressure. All right, systolic is kind of easy, right? Diastolic blood pressure is not the blood pressure of the heart at rest in diastole, because the pressure of the heart, the left ventricle in diastole, is about 0 millimeters of mercury. So that's not your diastolic blood pressure, right? So in terms of functions of the circulatory system, carries blood, exchanges nutrients, waste, and gases, transports hormones, components of the immune system, the antibodies, molecules required for coagulation or clotting factors, enzymes, nutrients, right? Gases, waste as well. And this is the ones we're going to really focus in on, regulating blood pressure and then directing blood flow so that we bring blood to most active regions. All right, the big picture thing I want you to always think about is this. The more active the region, the more energy it needs. The more energy, the more blood it requires. So let's talk about the vessels. Number one, arteries are, all right, remember, this is a closed system. So you're going to bring blood out of the heart through the arteries. I think they have a picture of that. I think in chapter 20 it showed it. All right, so blood gets moved away from the heart, arteries away. So keep that in mind. So any vessel that moves blood away from the heart is an artery. The good news is that, right, even the pulmonary artery, right, is an artery. We call it an artery because it moves blood away from the heart. Arteries carry blood away from the heart. Usually arteries have thicker tunics or layers. Usually arteries are a little bit more pressurized, a lot more pressurized. Arteries, the big ones, will eventually go to arterials. These are the smaller arteries that eventually then connect to capillaries. Capillaries are the area where gas exchange and substance exchange occurs between the blood and the tissues that require the oxygen and the nutrients, and exchange waste as well. All right, the capillaries then immediately drain into venules, which then many venules drain into fewer and fewer veins. Right, eventually all blood either drains into the superior vena cava or the inferior vena cava or the coronary sinus and enters the right atrium. Vasa vasorum are small blood vessels that supply blood to the cells of the walls of the arteries and veins. In other words, right, the cells that form the arteries and the veins also require blood. They also require nutrients like oxygen, like glucose, like fats. At the same time, it can't receive it, right, from the blood that's actually coursing through it. So it has its own blood vessels. It's kind of weird. So vasa vasorum are blood vessels that supply nutrients, supply gas exchange, and waste exchange to the actual cells that forms arteries and the veins. So there are capillaries for the arteries and the veins. Three main types of arteries that we'll talk about. There's also different types of capillaries, which you'll need to know, and then veins. So let's talk about capillaries first. Capillaries are where gas exchange occurs. Keep in mind, all right, arteries will bring blood and then into smaller arteries. But when blood goes through those arteries, the blood that's coursing through those arteries are very pressurized. It's being felt as pulses of blood moves through those arteries. Once it goes to a distal region, then the arteries will turn into arterials. And the arterials will then also divide into more and more capillaries. Capillaries are very thinly walled right here. If you take a look at it, capillaries are basically our endothelial cell, which is simple squamous epithelial cells, and a little bit of basement membrane, and that's it, right? So what we're going to see is these cells are very squished. They're squamish, right? Blood is going to go through the walls here, go inside of it in the lumen, and oxygen from the red blood cells diffuses through the endothelial cell, goes through the basement membrane, and then goes into the tissues. So the thinner the cell is, the greater ease for oxygen to diffuse out, the greater ease for carbon dioxide to go from the tissue cells into the bloodstream and into the red blood cells, or it can get converted to bicarbonate, which we'll talk about later on. So keep in mind, the big thing is the walls of the capillary are thin, all right, basically one layer of simple squamous epithelial cells. The more squished, the better. It allows for greater movement of nutrients through the cells. Lipid soluble things like gases and fats, right, goes right through from the bloodstream, through the walls of the capillary, and into the target tissue. Perfect. By the time blood moves into the capillaries, it is no longer felt as pulses. So when you get a cut on your fingertip, you don't bleed in pulses. You have this steady stream of blood that kind of oozes out. Why? Because when blood gets into the capillary, blood goes single file, right? Because the capillaries are so small, and it's no longer felt in pulses. Right? So capillaries, another example of this right here. Take a look. Look at how thin the walls are. Here's our simple squamish epithelial cell that we call endothelium when we find it in a blood vessel. Look at how thin the walls are right here. Here's the nucleus of it. Here's the nucleus of the other area. So the thin walls allows oxygen and gases and fats to just diffuse in and out due to the law of diffusion. They're found near every cell in the body, but very extensive in highly active tissues. Makes sense, right? The more active the tissue, the more energy, the more blood it requires. Function is to exchange nutrients and waste between blood and the tissue fluid, which then allows you to exchange it from the tissue fluid to the cells themselves. All right, types of capillaries. You do need to know this. Notice how red everything is here. So continuous capillaries are capillaries that have virtually no gaps right here. So you have the cell that the simple squamous epithelial cell, the endothelial cells right here, and there are no gaps found in the cell, no gaps between the cell. It's continuous. Usually there's tight junctions found between the cells. So then you limit the amount of even water that can get through. So continuous capillaries has no gaps between the cells, no fenestra inside the cell. So they're permeable only to gases, permeable only to fats. They're virtually impermeable to large molecules and less permeable to smaller molecules. We see it in areas where we need that kind of tight waterproofing, right? In the nervous tissue, in the muscle cell. Fenestrated capillaries. Now, with fenestrated capillaries, we start seeing fenestra. Fenestra are areas where the cytoplasm is absent and the plasma membrane is very thin and porous. They allow small to medium molecules through. We see it in the intestines. The walls of the capillaries in the intestines will be bringing in fats. It'll be bringing in monosaccharides. It'll be bringing in peptides, small little proteins, right? Tripeptides, dipeptides, right? So when it brings in peptides, well, you need to somehow bring it in. And if the vessels there were continuous, you have a hard time getting those peptides through, right? But with fenestrated capillaries found in the villi of the intestines, the amino acid chains, the polypeptides, can go through the fenestra, right? Go through the fenestra. The fenestra are like little windows, right, within the cell themselves. And when it doesn't have a diaphragm, like we see in this on the right side right here, right? So tripeptides and polypeptides can go right through the capillary and be introduced right into the bloodstream. Perfect. So fenestrated capillaries allow small and medium molecules like tripeptides, polypeptides that we ingest and we digest. They allow it to go from the lumen of the GI tract through the cells that absorbs the polypeptide and the tripeptide and into the bloodstream. Because in the capillaries, you have fenestrated capillaries that doesn't have diaphragm and allows larger molecules to get through. Now, at that point, you're still not bringing in like big proteins though. So we need larger holes in the capillaries to bring large proteins through. Sinusoidal capillaries, large diameter and with large fenestra, less basement membrane. This allows large proteins like thyroid hormone, like insulin, to be introduced into the bloodstream by cells that make the hormone. So let's take a look at the sinusoidal ones. Big gaps between the cells, large gaps and large fenestra with no diaphragm. So then when your thyroid gland produces thyroid hormone, the cell produces it and it's useless unless we introduce it into the bloodstream. So what happens? The capillary walls in the, right, kind of, in the thyroid, the capillary walls have large fenestra. So then I can make the thyroid hormone, which is a large protein, and the large protein as a thyroid hormone can go through the fenestra. And then once it goes through the fenestra right here, we are now bringing it into the bloodstream so then it can be sent to all the tissues that require it. Now, the largest type of capillaries are sinusoids. These sinusoids have little to no basement membrane. Large diameter sinusoidal capillaries. So huge sinusoids, right? And it looks like it has a little bit of the actual capillary punched out of it. So where do we see sinusoids? In areas where we are going to be producing or removing whole cells. Liver. We know the liver can produce red blood cells, especially as babies. The liver can also remove red blood cells, especially when the spleen is no longer active, right? The spleen's usual job is to recycle red blood cells. So in order to recycle it, you need capillaries in the spleen that has huge gaps. So then the big red blood cell can be removed from the circulation and recycled. But some people, especially people with certain disorders like sickle cell anemia, the spleen undergoes an autosplenectomy where you have so many infarcts that the spleen kind of auto-digests itself and starts to atrophy. Right? When that happens, it no longer is functional. The liver then picks up that job. The bone marrow also makes sense, right? In the bone marrow, you're making red blood cells and white blood cells. The red blood cells, white blood cells are huge cells, larger than any single protein. So in order to introduce whole cells from the bone marrow has lots of capillaries there that are sinusoids, huge gaps for us to bring whole cells from the bone marrow into circulation. So know and understand the differences in the capillaries. You will see test questions on it. Right now, the capillary network, we have an arterial right here that then goes through a metarterial. The arterial is going to be bringing blood under somewhat pressurized condition. Once blood goes into the metarterial, then we have little sphincters here. That looks like little rubber bands. The sphincters will direct blood into the capillaries when there's a relaxation of these sphincters. So what happens? Let's say you're exercising. As you're exercising and you're jogging, you need more blood to go into the active leg muscles. So in the leg muscle area, the capillaries there will have a relaxation of these sphincters. Blood is going to go through the arterial and then go through the sphincters into the capillary beds. As that blood goes through the capillary beds, oxygen diffuses out, bringing more oxygen to the leg muscles. Glucose is going to be diffused out in a facilitated fashion as well through the cell. So then you bring in more nutrients to that active muscle. At the same time, you have more blood coursing through here. You can then also exchange waste. Carbon dioxide is going to be produced because you're activating the muscle by aerobic respiration. The process of aerobic respiration produces lots of carbon dioxide in the active tissue. Carbon dioxide then gets released into the bloodstream. So then gets picked up and goes into the veins, right? Now, what happens though is that there's only so much blood, so that when we are active, if we are bringing more blood into the active skeletal muscle that we are using for jogging, well, that blood has to come from somewhere. So what happens, right? When you're exercising, you have more sympathetic output. So what happens when you have sympathetic output? You're not going to bring blood as much to the intestines, right? So we're going to redirect blood flow that should be going to the intestines. We're going to redirect it to the muscles. How do we do this, right? Again, in the muscles, we dilate and open up these sphincters, bringing more blood through those capillary beds. But in the GI tract, we close up the sphincters and they tighten. Because they tighten up right here, blood cannot get through and go into the capillaries. Because it can't get through the capillaries, it goes from one side of the arterial to the other side without any gas exchange, without any nutrient exchange. So then the blood goes through the venules and you never release any of the nutrients to that area of the intestines that are non-active at this point, right? Again, the opposite is also true. When you're eating, what happens? When you're eating, you're going to have less sympathetic drive, right? So what happens? Eating, that's rest and digest. There's more parasympathetic drive. So in the GI tract, you're going to relax these sphincters. So then in the GI tract, you have more blood flow going into the tissues of the GI tract. It allows blood flow to go in and absorb the nutrients, right? You also then supply oxygen and nutrients to the cells that are active at this point, which are the cells of the GI tract, right? Now, at the same time, you're going to tighten up and close some of these precapillary sphincters going to your skeletal muscles. So then there's less flow going through the capillaries. And you're going to redirect that flow through into the venules. Then you're going to target that to the more active vessels of your GI tract, right? That's how we are adjusting blood flow in regards to activity, right? Arteries and veins. We'll talk about the muscular arteries and veins, and then I'll take a little break here. So in terms of arteries and veins, right? Both arteries and veins, especially the large veins, medium-sized veins, and all arteries, even arterials, have all three layers. So we're going to see three layers in arteries and veins. The innermost layer is called the tunica intima. It's basically your endothelial cells along with some basement membrane. That's it, right? Now, when we talk about the capillaries, that's the very end of it. So this is a capillary right here. And an artery is going to see that same type of structure, right? Simple squamous epithelial cells with basement membrane keeping them together, and then some lamina propria, some connective tissue, maintaining the integrity of this tunica intima, right? You might have some internal elastic tissue as well in arteries, and what we're going to see in artery, especially compared to vein, is a very enlarged middle tunic or layer. That middle layer contains lots of smooth muscle. Now, depending on the type of artery, it has more smooth muscle or sometimes lesser amount, but a lot of elastic tissue. So one of the big take-home messages is that even though you might have more elastic tissue, right, this tunica media is also going to be full of smooth muscle, even with elastic arteries, right? That increased amount of smooth muscle allows us to vasoconstrict. The constriction then will decrease blood flow and or vasodilate. Vasodilation means you're increasing the vessel luminal size, increasing blood flow, right? Vasoconstriction decreases blood flow. Vasodilation increases blood flow, right? Then, in the most superficial aspect, we see the tunica externa. And depending on where we are, right, in a GI tract, we might have a tunica externa or an adventitia. This is just a connective tissue found on the externalmost regions of the artery and vein. Now, usually we can tell which one is an artery or a vein just based on the size and the lumen, right? Arteries without blood going through collapses. Let me rephrase that. Veins without blood going through collapses. I'm sorry, it's veins. All right, veins right here is a microscopic slide. Obviously, we've removed this from the person, and the vein no longer has blood going through it. Because there's no blood in the vein collapses. One of the reasons is that the vein has very little smooth muscle. So we're going to see arteries have a lot of smooth muscle, have a lot of elastic tissue as well. So even when there's very little blood vessel or very little blood coursing through, an artery will usually be patent, right? Be very wide open. So by looking at the size of the lumen, we should be able to tell which is an artery, which is a vein. Veins are usually collapsed unless there's blood going through it, and arteries are always open, even if there's no blood going through it. Right? So arteries, functional properties of arteries are that they're elastic and they have some form of contractility. Elasticity is due to the increased amount of elastic tissue found in the tunica intima and media, allows arteries to accept blood under great pressure. Now, if you think about the aorta is going to be receiving blood, a lot of it, under tremendous pressure, right? And as it stretches, it's going to act as a secondary pump and send that blood that it receives through the cardiovascular system, giving you more of a forward thrust, right? Contractility, due to the smooth muscle in the tunica media, allows arteries to vasodilate or vasoconstrict. Now, the types of arteries, we have elastic arteries, largest diameter, highest pressure, fluctuates between systolic and diastolic blood pressure, more elastic tissue than smooth muscle, contains a relatively thick tunica media, and that tunica media has more elastic tissue. Why do I keep mentioning it? It's because of this. Elastic tissue includes the aorta, and includes your brachiocephalic trunk. All trunks that we talk about are made out of elastic arteries. What elastic arteries allow us to do is this. As blood is moving past the aortic valve into the aorta acts like a rubber band. It stretches. As it stretches, right, as that blood from the ventricle is ejected outwards, right, it stretches that aorta, it stretches the elastic connective tissue. Then as the left ventricle starts to relax and the pressure starts to drop, the stretch of the aorta causes us to push some of the blood forward and acts as a pressure reservoir, right? So if it's before, right, if it's after this loop right here, then you're going to force that blood out into the rest of your systemic circulation. If it's before that loop, blood's going to move push downwards to close that aortic valve. So elastic arteries act as a pressure reservoir. Muscular arteries, that's usually the name arteries named after the organs that they go to. Superior, inferior mesenteric arteries, renal artery, gastric artery, all of those arteries, hepatic artery. These muscular arteries contain a lot more smooth muscle, therefore allowing more regulation of blood supply by constriction and vasodilation. All right, even smaller unnamed arteries are muscular in nature. Contains thick walls of 25 to 40 layers of smooth muscle. They're also called distributing arteries because the smooth muscle allows blood vessels to partially regulate blood supply to different regions of the body. Again, what we're going to normally see is this. Keep in mind, from 201, when you have sympathetic output, you're going to bring more blood to the skeletal muscles, bring more blood to the lungs, to the brain. What happens then? You need to vasodilate the blood vessels going to the muscles. Right? We're going to distribute more blood then to the skeletal muscles. Then, because you're exercising, that blood has to come from somewhere, right? That increased blood flow. Well, it comes from redirecting blood flow that was supposed to go to your GI tract. So the blood vessels that go to the GI tract, superior mesenteric, inferior mesenteric, gastric, hepatic artery, even the renal artery slightly vasoconstricts, allowing less blood to go through and less nutrient will be wasted in that area. So they can then redirect it, all those nutrients, all that blood to the more active tissues, which is your skeletal muscles. Now, eventually the muscular arteries turn into arterials. Arterials are the big player here. They transport blood from smaller arteries to the capillaries. All right, this is what makes them important, right? Because of the number of arterials, right? There are very few numbers of elastic arteries. There's slightly more muscular arteries. There's tons of arterials, right? They can vasoconstrict and they can vasodilate, just like the muscular arteries. Because they can do both, vasoconstrict and vasodilate, and because there's so many arterials in our body, it is these arterials that plays the biggest role in regulating blood flow from arteries into capillaries and plays the biggest role in altering arterial blood pressure. Again, right? It's so important to know this because they play the biggest role in blood pressure regulation. When we give people antihypertensive agents, we are affecting the smooth muscle in the arterioles, allowing them to be slightly more vasodilated. Different vasodilators, right? Different medicines will affect different ways, right? Some of them will decrease the force of contraction in the heart, are beta blockers. Some of them will be like calcium channel blockers, right? Which allows us to regulate blood flow and blood pressure in the arterioles by vasodilating them. Eventually, the capillaries drain into the venules. Venules are made out of endothelial cells with a basement membrane and a slight amount of smooth muscle. As the diameter of the venules increase, the amount of smooth muscle increases. They have very porous endothelium. So when blood pools in the venules, you can have lots and lots of water that can leak out and you have edema as a result. Now, that's a bad part of the porous venule right here. The good part is, right, because they're porous, white blood cells can exit out in those regions and go to regions where infections occur. The venules then drain into veins, the small veins. At the small vein level, we see all three layers, but we're going to see that they don't have a very big layer of smooth muscle. Right? Medium and large veins are the go-between. The medium veins are the go-between between small and large veins. Large veins have very thin tunica intima, The tunica media has circularly arranged smooth muscle, but the layers of smooth muscle are very, very small amount of them compared to a similar size artery. The biggest thing in the large vein is a huge amount of adventitia, right? External connective tissue. Right. Now, what helps blood go through the vein are valves, right? So in terms of valves, valves allow blood to move upwards against the flow of gravity. Keep in mind, blood pressure in the vein is very, very low. So as we're sitting and we start studying for the exam, if you're sitting for a long period of time without movement, what's going to happen is blood pressure is not enough to force blood from the veins back to the heart. The blood pressure in the veins is very low and cannot go against the force of gravity. So what we're going to see is that in order for blood to go from your extremities back to the inferior vena cava, back to your superior vena cava, you're going to need a little bit of help for blood to move through and back to the vena cavas, right? The first thing we're going to see is that veins have lots of valves, right? Valves found in all medium and large veins. They are folds in the intima that overlap. You have more valves in the veins of the lower extremity than in the upper extremity, right? And it kind of makes sense why, right? The veins of the lower extremity is lower than the heart. So gravity plays a bigger role, plays a bigger negative impact on blood returning through these veins back to the heart. If you have blood in the upper extremities, well, blood in the upper extremities coursing through the vein, you don't have that gravity that you're working against, right? Your upper extremities are at the same level as your heart. Your lower extremities are lower than the heart. So in order to move blood from the lower extremities through these veins into the inferior vena cava, you need a lot of help, right? One of the ways we help is by having valves, right? So take a look at these valves. Keep in mind, valves always work to prevent backflow. So what I'm going to show is I'm going to move this ahead a little bit, and I'm going to go and discuss right now, not just the valves, but, right, I want to discuss valves along with the skeletal muscle pumps right here. So here, take a look at it in slide 49. Now, why did I mention this is because this venous return, right, is caused by the skeletal muscle pump and the respiratory pump working with the valves to move blood against the force of gravity into the inferior vena cava. And from the inferior vena cava, breathing exercises allows us to move blood from the inferior vena cava into the right atrium. So let's take a look what happens here, right? Volume of blood flowing back from the heart from the systemic veins is called venous return. Depends on the pressure difference between venules and the right atrium against the force of gravity. Tricuspid valve leaky and can lead to buildup of blood on the venous side of circulation. So this is just kind of a condition that can happen. Now let's talk about these two pumps right here. Right, I highlight it. I want you to know what they do. Right, in terms of the skeletal muscle pump right here, what happens? Right, this is one of the reasons why we always want people, if they're able to walk after a surgery, as soon as they're able to walk without risk of falling, right? We want that person post-op to be able to walk by themselves almost immediately. The reason why is because of venous return, right? If they sit down and they can't walk and they're laying down for a prolonged period of time, blood that's not moving in these veins will pool and cause blood clots, right? So by moving and having those patients walk around, we're activating these two pseudo pumps, the skeletal muscle pump and the respiratory pump. What happens? So when you're activating the muscles by walking, right, you're contracting the muscles. As you're pushing off, the muscles contract and the veins deep in your leg, your lower leg, right, get squeezed because they're so close to the muscles. So as the muscles contract, it squeezes a vein, causing blood in the vein to move upwards. As you relax, the muscles relax, the veins relax. Blood then that you moved up comes back down. But as it goes back down, it hits that valve and closes it. As it closes that valve, we have moved that blood up from here up one level. Perfect, right? Then when you contract the muscle again, right, blood is going to be moved up another level. And with relaxation, it sits at that level until the next contraction. So with the skeletal muscle pump, the rhythmic contraction and relaxation allows blood to be pushed upwards. As it's pushed upwards with contraction, with the relaxation that occurs next, blood moves back down because of gravity, but it closes that valve. As it closes the valve, I've moved up one segment. The more rhythmic the contraction, the more often the rhythmic contraction occurs, the more we go from one segment to the next, to the next, to the next, eventually moving blood from your lower leg to your upper thigh, from your upper thigh to your inferior vena cava in your abdomen. Right? Now, what happens in the abdomen? Then in the abdomen, we have the respiratory pump. Right? In the respiratory pump, we're going to have decreased blood pressure, right, in the abdomen. And in the respiratory pump, the inferior vena cava is receiving that blood. And it's still, if we're standing, that blood that's sitting in the inferior vena cava is still lower than the level of the heart. So gravity is pulling on it, right? And it's kind of a negative impact, right? It resists movement of blood towards the heart. So we have this pump that helps. This pump is basically taking a deep breath and then pushing out, right? What we do when take a deep breath is this, right? Based on Boyle's law, we have an inverse relationship between pressure and volume. An inverse relationship between pressure and volume. As volume goes up, pressure is going to decrease. That's what we mean by inverse relationship. So what happens when you take a deep breath? When you take a deep breath, your abdominal muscles contract, right? So what happens when the abdominal muscles contract? The abdominal size decreases. When there's decrease in volume, the opposite occurs in the pressure. So when you take a deep breath right here, your volume of the abdomen is decreased. All right, that causes a pressure increase in the inferior vena cava. So now there's greater pressure when you take that deep breath inwards. What else happens? When you take a deep breath, your thoracic cavity size increases. As your thoracic cavity increases, since there's an inverse relationship between pressure and volume, as the volume increases, it will cause a pressure drop. And that's what we will see, right? So what we will see is that as we take a deep breath, the respiratory pump will favor movement of blood from the abdomen, from the inferior vena cava to the right atrium because of this. So as you take a deep breath, the volume of the thorax increases, which causes a drop, right, in pressure, right, causes pressure to drop in the thorax. At the same time, the opposite is occurring in the abdomen, right? In the abdomen, the volume is going to decrease. As the volume decreases in the abdomen, it will lead to increase in pressure in the abdomen. and in the inferior vena cava. So that is what we see here, right? What we see then is that there will be a pressure drop in the thorax because you're taking a deep breath. At the same time you have a pressure drop, you will also see a pressure increase in the abdomen. You have more pressure in the abdominal vessels, less in the thorax. You can more easily bring blood from the inferior vena cava in your abdomen into the right atrium. Perfect. That's exactly what we want. Right? So there's these two pumps along with the vein and along with the valves found in the vein allows us to move blood back to the heart against the force of gravity, which is excellent. And I'll stop right here.